Hello friends, I am Dr. Sandipaa. Welcome to my YouTube channel Homeopath. In this channel, I will be discussing practical application of homeopathy and how to practice classical homeopathy and cure each individual patients. So in this series, I have already done a few videos, friends. So today subject is first prescription. So everybody knows about second prescription, as Dr. Kent has explained it, and he has detailed about what will be the second prescription. So first we will understand what is first prescription. So first prescription is a prescription for a patient. So if it is an acute condition, acute medicine is indicated. That will be a first prescription for the patient. Whatever the medicine given at a first instant, depending on his symptomatology, depending on his presentation of the symptoms. So homeopaths usually come across chronic diseases. So these chronic diseases needs a proper evaluation, proper case taking, proper repertorization, proper understanding of each individual person in his totality, his mind, body, and his activities and his hobbies, his habits, his total character, how he responds to the situation, what is his miasmatic background. So this all put together, the medicine coming out will be the first prescription. So first prescription is nothing but similimum, which is required for each individual patient. So first prescription, whenever you do, you will be taking note of all the deviation from healthy state to the diseased state. So this is what we require for the first prescription. So nothing but it is a similimum required for each individual patient. In this, we will be taking note of so many minute details. Many times if you miss the miasmatic background which he is representing, the totality may be matching. But miasmatic background is a key factor, as our Dr. Hahnemann tells that in chronic patients, if you miss miasmatic background indication, then totality is half and the medicine will not act. So Dr. Hahnemann has struggled for 12 years to understand this miasmatic background. So this 12 years, what he was finding was the root cause of the disease and how this miasmatic background, that is nothing but a genetic factor of each individual patient, how he responds for the stimulus. So this is miasm. So miasmatic understanding requires a little more energy and your application of your mind so that you understand how he responds for a stimulus. One respond in rejection, one respond in acceptance, one respond in between. So this is all responses are the key factor to find the miasms. As our Dr. Vijay Prafulkar tells that there are basically three miasms, as our Dr. Hahnemann also tells, basically there are three miasms. Whenever a stimulus is given to a human being, he responds basically in three forms: flight or fight, or he will not react. So all three reactions or all three responses are nothing but miasms. So in chronic diseases, what we will be looking into is totality of the symptoms, individuality of a person, miasmatic background, and his totality must reach his total life events, what he has come across and what he has dealt with. That has an impression on his mind, body and his total structure. So if a psoric person is there, he will be always hopeful. He will be always solving the problems in a very systematic way. He will not be hopeless. He will not be despaired. But a psychotic patient is in between patient. He will be confused. He will not take a decisions. He will be always postponing. So all these things, if you have a total idea what miasm represents, what character of a patient, when a stimulus is given, how he responds to a stimulus, that is very, very important for the first prescription. First prescription is the total representation of his life events, of his symptomatology, of his miasmatic background. And lastly, a potency is very, very important. Why it is important means, when there is a pathological process going on and pathological findings are there, we must not give higher potencies. So this is a basic understanding of posology. You must go with a very low potency. If the pathological changes are not there and only a functional disorders are there, then higher potency will do wonders. This understanding, this basic understanding is very, very important in first prescription, friends. So first prescription is nothing but your totality of a patient, what you are giving at a first instant. So this is just half the job. Why? Because what is the second prescription? It is very important to give a second prescription. Dr. Kent has explained it very nicely, and second prescription all homeopathic doctors, homeopathic students, fellows and everybody knows. But first prescription is a first thing you must be dealt with and you must understand. Then a second prescription comes. So this second prescription, as Dr. Kent explains and as I understand, I will be explaining in the next video, friends. So this is all today's session I want to talk about. First prescription. If you have any doubts, please put in the comment section. If you have any queries, please put in the comment section. If you have any interesting subject about homeopathy, please put in the comment section. I will be doing those videos also, friends. This is all in this today's session, friends. Thank you and take care.